I guess the better than Ozempic, as if Ozempic is so good.
Well, you have to admit it does work. You have seen it work for people, and a lot of people lose weight.
It doesn't, it works partially. So let's say how much it works, because people in a year could lose as much as 10 to 15% of their body weight. So let's say a person comes in at 250 pounds and their ideal weight is 150 pounds, a male at 5'8" or 9 or 10, 150 pounds would be a good weight. So they have 100 pounds to lose. So 10% of their body weight at 250, they can lose 25 pounds on Ozempic. They can get from 250 to 225, maybe 230, maybe 240, maybe they can lose 30 pounds or 40 pounds. But they're still 60 pounds, 70 pounds overweight. They didn't learn how to eat. They're just using a chemical that makes it a little painful when they overeat sometimes. So they eat a little bit less. They don't have to worry about the quality of what they're eating. And that 10% to 15% of weight loss is not significant enough to prevent them from getting cancer, heart attacks, strokes, dementia in the future. They're not really learned a way to get all their fat off. And then worse than that, if they stop it, they gain the weight back again. Now, one thing we know is that losing weight and gaining it again is worse than never losing it. If they just stayed at 250, they'd be healthier than dropping to 225 and going back to 250 again. And so they're going to get worse, and the disease and their overall risk of death will enhance from Ozempic, because when they stop the Ozempic, they'll bounce back their weight, and the bounce back is going to cause damage to their body. Furthermore, Ozempic is linked, and other drugs like that are linked to increased risk of thyroid cancer and thyroid tumors. So if they don't plan on ever coming off it, they want to stay with it for the rest of their life, then they're probably going to cause cancer. Because no drug with that's pharmacologically effective is non-toxic. Drugs are poisons, they're toxins, that's why they're prescribed. And even the drugs that aren't prescribed are still toxic, but still the gatekeeper of the drugs are doctors to prescribe them so people don't use them indiscriminately. But the doctor doesn't really have a gatekeeper. He's just a glorified pharmacist giving people drugs whatever they want, so he can make it's his business. He's dispensing drugs. Yeah. And they don't learn to eat healthy. It's like a blood pressure medication where they don't learn to remove the cause of blood pressure. They just don't think they have blood pressure problems anymore, which they do. So they're still eating bad food, still damaging their body. True, 25 pounds of weight loss is still better than not losing weight if it was kept off forever, But compared to compared to a Nutritarian diet, where you're going to drop the whole 100 pounds you have, and you're really going to learn how to eat healthy, it's not in the same ballpark.
So you brought up some scary points, but you've always taught me that when medications are involved, you said there's always a cost.
Always, that's right.
So
you pay a price.
You pay a price, and there's a side effect. There's usually a long list of side effects. So there are a long list of side effects with Ozempic as well,
including gastroparesis, which means paralysis of the digestive tract that could take a long time to go away. So including a contaminant. So it's not. So yes, it has some nausea, vomiting, gastroparesis that can be long term. But yeah, so you're taking a risk, but the risk of remaining obese and diabetic is severe too. So overall, the benefits of Ozempic still may show long-term benefits for these overweight, pre-diabetic, and post-diabetic individuals. Nevertheless, just because it's better than doing nothing, it still has dangers, and comparatively to doing it naturally, where a person can really protect themselves, really remove their problems, and learn how to live and eat the rest of their life. And there's a lot of little tips and tricks. But I think the reason why these weight loss drugs are so popular is because people couldn't lose weight no matter what they did, because they were so nutritionally ignorant that they tried to cut back on calories without increasing nutrient density of their tissues, which led to an overwhelming, unrelenting desire to overconsume calories. And then diets don't work. So the failure of diets is really the failure of people to understand nutritional science, and weight loss specialists and doctors advising their customers about nutritional science. They're giving them bad information begets bad results. Good information begets good results. And then so they give them Ozempic because they don't have good information to give them.
Well, and you hear it all the time. I hear a lot of my other physician friends say, well, people just want a magic pill. People don't want to change their habits. People want this. And I always rebut that by saying, well, at least give them the option, give them the education and both options. I feel like we're missing that education piece when you're in the doctor's office.
The doctors are ill-equipped, untrained, and not motivated to educate and to teach people to make dietary changes. Not only are they not motivated, their ratings as a doctor and therefore their payments they get are linked to their prescription patterns and how they prescribe drugs. So should they try to spend more time talking to people and prescribing the less drugs, they'd be penalized both in their monetary reimbursement and in their rating scores from the health insurance companies as a doctor that's preferred. So they would do, well, it's not a preferred doctor. The best doctors are doctors that prescribe the most drugs.
And even some lifestyle physicians, naturopathic doctors, people with more of a natural stint, I kind of see some of the same habits going where it started. Maybe they'll start with education, but then they'll say, oh, but you can do this weight loss drug as well. You could do, which, yeah, I guess there's room for both. You know, if someone really will not change their lifestyle, you want to ask yourself, is Ozempic the better option? But my question is, why did you say they only lose 10 to 15%? Because I feel like we've seen certain celebrities that look a lot thinner.
Mm-hmm. Well, we're talking about scientific studies.
Mm-hmm.
You know, what are in practice, cholesterol and drugs, you know, in actual practice, what do we really see out there on people using them? And there are studies on this, and as they do studies with a larger number of people, you get more accurate data. And sometimes it takes even a decade after the drug is first introduced to have enough people using it, where we enough for a long enough period of time, where you see the accurate data about the drug and the true dangers. Almost every drug introduced in medical history has shown more severe dangers than the people prescribing and advocating the drug initially thought at the beginning.
Mm-hmm.
So you take proton pump inhibitors, the reflux drugs that people who have reflux esophagitis. They were first prescribed only for short-term use, people with ulcers or reflux for like taking it for 2 to 3 weeks or something.
Sure.
But then doctors started prescribing them, people take them for years.
Mm-hmm.
So now, you know, now that they're out in the market for 20 years, we see that those drugs are linked to heart attacks,
mm-hmm.
and they're dangerous to stay on long term. We didn't know that the first 5 years they were out.
Right.
You know,
for sure.
So every drug loses its heyday and gets into a phase of black box where you know you have to be more careful prescribing it because we never knew it was so dangerous.
Mm-hmm. Yeah.